If we can teach the ideals of justice, of equality, of being egalitarian, that's why we started the movement. That's what it was all about. Because again, I'm but a foot soldier in this, representing anyone who has contributed to moving us forward for the good of our patients in the community, not for the good of one individual. So I was born in South Texas. It was a very different time in South Texas in those days, the late 40s, the early 50s. We were all classified as Mexicans, and we weren't treated very well. I was offered a job as a community organizer in La Junta in southeastern Colorado at the end of '72, and I jumped at the opportunity. And so one of the first things I did was help to start a co-op, a food co-op. The next big project that came up that needed to be addressed was that of health services and health care. Now, one needs to understand that this is a really different time in our country's history. This was before a federal law called EMTALA, the Emergency Medical Treatment and Labor Act, which was passed in the mid-'80s. So this is a dozen years before. So in our country, you could still legally be turned away and refuse health services at a hospital if you didn't have money. In 1973, I was living in Rocky Ford, and it was there that as a community organizer, I realized that what we needed was to come up with a different system of health care for the Chicano as the community, because we were being excluded from the system of care that existed at that time.
We had to deal with the politics. It was like David and Goliath almost.
At the beginning, it was a really downer, negative ideas about it, and I'm just thrilled that I was a part of something big that happened.
Hopefully, Dr. Licona and my story and other people's stories will be able to help recruit young people into a health profession, because it's been a really, really great experience.